So our speaker of the day will be Wang. So Jane is the co-founder and CEO of Rosesso Technologies. Jane worked in several multinational companies and excel at multiple functions, including engineering, human resources, sales, and consultancy. Jane has been always an entrepreneur at heart, having started an e-commerce business as just 20 years old. And now at Rosesso Technologies, she is changing life by incorporating robotics technology into rehab. So the topic of today's webinar is soft exoskeleton for hand rehabilitation and its application at home environment. So without further ado, please welcome Jane.
Okay, yeah. So first of all, thank you, Jake, for the introduction. So I'm the co-founder and CEO of Rosesso Technologies. So now let me just introduce today's focus product, which is Exoglove Hand Rehabilitation System. So here you can see the product is actually quite simple. So we have a software system, and we have a control box with touchscreen, which means that the device can be used in different modes. One mode is with the touchscreen and the glove. So this is more for early mobilization. For example, if patients have just had a surgery and still bedridden, actually we can start very early mobilization to prevent muscle contracture spasticity from happening. The other mode, of course, which is the most highly recommended mode, which is using the computer user interface, because here we are providing action observation therapy with videos. With multiple clinical trials, we have approved that action observation therapy is important or effective for motor function recovery. So at the same time, we have intention-driven active training, which means we can utilize patients' residual movement on the fingers to detect patients' intention and to activate the glove so that we can provide active training to further improve the neuroplasticity from forming. So the device is very light, is very easy to wear. The setup time is less than 3 minutes. And it's very portable, less than 1 kg. So which means it can be used in any environment, including home environment. So the device, the glove is very light. So here you can see I'm just holding this soft robotic glove. Everything is made of soft materials like fabric. So we have 3 sizes. One size is S size, the other size is M size and L size. So the lightest S size glove is only 150 grams. L size is 180 grams, which means patients can really lift up their arm and to conduct functional task training, which is very important for them to achieve independence after using the device. So we are saying we are not only training the hand, but also we are focusing on the whole upper limb, for them to become independent. So here I'm going to show a video of the device. So just a quick demonstration video.
Imagine being hit by a stroke. You are left paralyzed, bedridden and helpless. What if we can help you move again? The Exoglove is a soft wearable robot that provides robot-assisted hand therapy with our unique soft actuator technology. It is fully made of light fabric and biocompatible materials, offering top comfort and supporting natural hand movements. The Exoglove can be used at its own for passive and active hand exercises, combining with action observation therapy and active assisted therapy with user intent detection. It offers longer period of training with higher intensity and minimal supervision. These features have been clinically validated. Multiple clinical evidences have shown that action observation therapy and intention-driven training are able to allow patients to relearn impaired motor functions. It is able to support individual finger movements and functional task training, which retrain the brain to learn key activities of daily living for functional motor recovery. The Exoglove can raise therapists' productivity through robot-assisted therapy with minimal setup time. It will also improve hand mobility and level of independence in performing common daily tasks, thereby enhancing quality of life. At Rosesso Technologies, we bring back patients' independence and dignity.
Okay, thank you for watching. Yeah, so just now the video that you have seen is actually the first model of IsoGlove that we launched. It's IsoGlove Pro. And after launching the product since 2019, in very specific selected markets first to get feedbacks, we have received a lot of improvements, feedbacks in terms of quality, in terms of design. And after that, we have also created other models of IsoGlove. So here's the first model just now I have introduced. So we have passive mobilization exercises and active assisted exercises, and together with real-time 3D representation, which we call action observation therapy. And at the same time, we have functional task training with real objects. So, and for the second version model, IsoGlove Pro Lux, which is more for patients with limited upper limb movements on elbow and shoulder. So we integrated with dynamic arm support to compensate the weight or the gravity of the arms of the patient's affected side, so that we can help them to move the arms while doing functional task training. So by end of this year, we are going to launch IsoGlove Mio. IsoGlove Mio is a Mio electric IsoGlove with EMG sensors. So we are able to detect patients' intention to move the hand by utilizing the EMG signals, and also provide real-time EMG feedbacks to promote motor relearning and to improve the neuroplasticity. Yeah, so here is just a very simple prototype video. I think it's not really working. Sorry about that. Oops. Okay. Yeah, sorry. I think the video has some issue. But anyway, basically, you can see from the sensor here. Actually, this is the old prototype. For the new prototype, it's going to be something like this. We are not using electrodes, traditional electrodes. So basically, it's actually safer or cleaner to use this kind of dry electrodes. So with the electrode, actually, we can detect the muscle signal for flexion and extension, and eventually we can trigger either opening or closing or both for patient's hand. Also, we can utilize the EMG signal for patients to play active games, integrate gamification to make the whole rehabilitation process more fun. So now I'm going to show some of the clinical trial study that we recently published together with NUH and NUS. So this is more to prove the efficacy of action observation therapy. So for this clinical trial, the study's name is the effect of soft robotic glove assisted proprioceptive training on motor activation and brain connectivity in stroke patients. So it's a relatively small trial with only 10 stroke patients with hemiplegic upper limb. So here are the general information about the patient's situation. So the age is the median is 52.7, and we have more males than females, and more ischemic stroke, 9 of ischemic, and 7 right hand and 3 left-handed. Yeah. So basically, the study design is basically have 3 parts. The first part is we ask the participants to engage in a resting state and motor task fMRI. So the motor task comprises 2 conditions. One is active movements of the fingers, basically, which means the patients have to move their hand by themselves. And the other one is glove-assisted movements using the robotic glove to help them to move. And after the first fMRI, here you can see this is the details of the MRI scan. So patients are given cue here so that they can see and they know what they have to do. So some of the training are active training, some of the training are robotic glove assisted training. So after this scan, we are going to ask patients to do action observation therapy for 30 minutes, which is here. So action observation therapy, basically patients are watching the videos and they follow the video, and the glove is assisting them to finish the actions. And after that, we repeat the same fMRI scan to look at the differences on different parts of the brain. Yes. So here is the what has done during the scan session. So we have active affected side and glove assisted affected side, and active both, which means both hands have to move together. And this is glove assisted both hands. Yeah. So this is just sharing of part of the results. So for this one, you can see pre and post of the glove assisted affected side, which means this is the fMRI image that we took during the glove-assisted affected side movement. So you can see before and after the action observation therapy. Yeah, we can see here is the result. The glove-assisted task resulted in increased activity in the mirror neuron circuit, including inferior parietal gyrus, SMG. So SMG is the part of the brain that is in charge of the space and the location of the limbs. And the angular gyrus is actually location, the brain location that is in charge of speech and language and other parts of the brain. So the mirror neuron circuit was shown to influence the recovery performance in stroke patients. So basically, this is to prove that glove-assisted tasks actually will likely be influencing the recovery process performance in stroke patients, and also will be improving the motor activity and observation of the movements. Yeah. So this is another observation, another result. So the brain network alterations in stroke following 30 minutes action observation therapy. Basically, for this conclusion is increase of coherent connectivity in the sensory motor network. So also SMG and primary somatosensory cortex. So this result is consistent with a previous study, which shows that increase of sensory motor network connectivity is positively correlated with upper limb motor function improvements following a single session of robotic training. So basically, this study simply concluded there are potentially positive effects from action observation therapy and robotic glove assisted training. But we also, there are something that we didn't show here. Actually, we also discovered that if patients are moving both hands together, it's more effective than using single hand. So that's why for right now, our patients, we are encouraging to move both hands, including the healthy hands together. Yeah. So now we move into the home rental session. So after COVID started since last year, we slowly receive a lot of inquiries from patients in Singapore to ask to use isoglove at home. So we realized in most of the therapy sessions in rehab centers, a lot of times therapies are focusing on lower limb or big joints like shoulder and elbow, but hands normally are not the part that therapists will focus on because you only have limited time. So they will be focusing on those parts that they think are more important or easier to recover, or will be more effects will be seen. So that's why a lot of patients, they have been really looking for robotic devices to use at home for just hand. So that's why we immediately received a lot of inquiries, especially after COVID happened. So just now you have seen isoglove is very portable and it's very easy to set up. So that's why at home setting, I would say this device is very optimal. So what we need patients to provide is laptop, table and chair, and power supply. Yeah, so roughly this kind of setting. So it can be a very small table as well. So the arrangement, okay, so far most of the patients we have are chronic patients, 1 to 4 years post-stroke. But of course, we always encourage patients to start as early as possible. Yeah, so I think till this year, we have been receiving more and more newer patients who are approaching us. So for the home rental arrangement, we normally start with a demo session first. So for the demo session, either patients come here or we visit them at home. So most of the patients, they will be asking us to go to their house. Also, we would like to understand, their home environment, what is the best location to put the device and so on. We'll be also asking, do some assessment on them and understand the treatment history and who are they working together right now. And many of them, unfortunately, are not going back to therapy anymore. So after the demo session, if they have decided to rent the device at home, we'll do installation and training, and we'll do assessment and prescribe the training protocol. So every patient is different. So for IsoGlove, we have multiple exercises. So for example, for passive cyclic training, we have 5 exercises. For functional task training, we have another 5. And for active training, we have 8. So in total, we have 18 exercises. So based on patient situation, we'll be basically designing a protocol for them. So they have to work with IsoGlove at least 1 hour per day. That's what we have been encouraging them. They are all very busy. Many of them they are fully booked for therapy sessions. So that's why we have to encourage them to really squeeze in at least 1 hour for the session. And every month we are going to provide monthly visits. So the monthly visits will be including assessment and adjustment on protocols. But in the future, definitely we are going to look into how to do things more remotely. But of course, in Singapore, it's a small city. That's why with some human touch, sometimes the communication is better. So for the assessment, we have 4 assessments. The first one is grip strength, and second one is hand mobility. So for this part, we also took a lot of videos to monitor the progress. We also compile reports to send to patients to encourage them. Of course, for hand mobility, we can do Fogel-Meyer as well. Fogel-Meyer is basically pretty much full body, but sometimes we also conduct, only the hand part or upper limb part of the Fogel-Meyer study. EMG signals, muscle signals, we are taking from the patients to see, especially the extensor signal, whether it's improving, because most of the chronic stroke patients, they have spasticity on the hand, and the hand certain level of muscle contracture. So that's why the main game at the beginning for us is really to relax muscle and improve the flexibility of the hand and make sure they can slowly open the hand. We also measure fingertip to wrist distance. This is also for spasticity measurement. So now I'm just going to show some results with the past more than 10 patients that we have treated. So this is a summary of grip strengths. So here you can see this is for each patient, the data. Here you can see there are quite obvious improvement. So there is an average 42% improvement of grip strength after 1 month of using IsoGlove. And there is an average of 154% improvement of grip strength after 3 months. So actually the data is not super updated. we didn't really consolidate more data. This is our bad. But generally you can see the trend. But of course, when you talk to doctors or therapists, they will say how grip strength may not be a good thing for stroke patients. However, we also observe significant improvement on relaxation of muscle as well. So I'll show later. So here we just want to explain, increase grip strength doesn't mean increase spasticity. Yeah, so maybe I just skip this part. Here I'm going to show some muscle hand movements video. So this is patient S. So at the beginning, you can see in November, the hand is quite rigid. Basically, he's not able to open or close the hand at all. So after 4 months, with daily 1 hour training, we can see very significant reduction in spasticity and improved hand relaxation and hand opening. Yeah, so this is initial, and after 1 month, after 2 months, 3 months, and 4 months. So now he's able to grasp things and open doors by himself. This is another patient, also a similar effect. So at the beginning, basically, there's no observation on hand closing or relaxation. And after 4 months, we can see very obvious improvement on hand relaxation. And this is another patient. Actually, he's our first patient who started in September 2020. So the beginning was also really, it's already more than 1 year of stroke and very minimal therapy sessions. So you can see at the beginning, the hand spasticity is really bad. It's very tight. MS score probably is around 3. And after 7 months, actually he's still renting. After 7 months, daily 1 hour training. No, sorry. So we can see the hand is very relaxed and he's going to grasp objects with his hand. Yeah. So this is definitely improved mobility for him. And he's already almost 70-year-old, but he's still very hardworking. So another patient, so after 6 months, so his hand spasticity is not bad since the beginning. So he can already close a little bit. And so after 6 months, what we see is more relaxation, more opening, and we can see individual finger movement already. Yeah. So for this patient, I think they are quite encouraged. And after 6 months, they decided to renew for another 6 months to continue the positive effects. Yeah, so here you can see individual finger movements for him. Sorry. Okay, I think this is another patient who is supposed to join us today, but I think he's very busy. So the initial state is also quite rigid, and he did some Botox in the middle of the progress. But actually, this is pretty much his current situation, even after the Botox effects reduced. So he's very hardworking. He worked 2 to 3 hours per day while running his own business. So after 7 months, we see that he has reduced spasticity and very much improved hand relaxation. So now he's using his hand quite frequently to open fridge doors, to open just normal doors and do things by himself. I think this is pretty much the last one. So after 7 months for this patient, we can see that he can close his hand properly, and there is an improved hand relaxation also. So now I just show some data on the EMG signal. So EMG signal is, sometimes the hand is very spastic, so you are not able to see obvious opening from the patients. But actually, if we look at the EMG muscle signal, we can see the improvement on the extensor muscle. So here, for this patient, in November when we just started, so we couldn't see very obvious extensor muscle signal during hand opening task. And by March, after more than 3 months, we can see quite obvious extensor muscle signal. So the strength is more than 10 times of the baseline. And for this patient, it's similar. It's not that obvious, unfortunately, but we can still see improvement 1.5 times baseline of extensor muscle signal. So basically for us, that's why after observing all the signal improvement, yet the movement is not that obvious. So we started to do more stretching to make the flexion muscle more relaxed so that we can slowly see the movement of the opening. So this one is increasing from 1.5 times baseline to 3.3 times. Yeah. So fingertip to wrist distance. So this one is more for to observe their spasticity. So here you can see that for patients who have very severe contractures, MS score 2 or some are even more 3. The middle finger to wrist distance was measured every month. And the middle fingertip to wrist distance was measured before and after the task. Yeah, so sometimes after patients started to move their hands, right, the hand become tighter. So that's why we do 2 measurements. One is before, the other one is after. Yeah, so it's we get the average, so it's more accurate. So we have seen increased middle fingertip to wrist distance was observed on both patients before and even after the task. So indicating that the spasticity of both patients have reduced. Yeah, so this is also, yeah. So basically this is the our measurement so far, the data that we have collected on the home rental patients. So for all these patients, so far I would say most of the patients are very satisfied with the increased intensity of training by doing home therapy. Unfortunately, in Singapore, I think we do have some challenges because of the reimbursement. In Asia country, we do have limited reimbursement on home use rehabilitation robot devices. So that's why most of the patients are paying out of pocket or with support from their family. So that's why we are hoping in the future we can work with some NGOs or even with government agencies to provide more support for rehabilitation home use devices for patients to use at home. So some challenges for home rental. One is logistics. So basically we have to really actively visiting patients every month. Thankfully, in the future, we are going to have more remote training sessions as well, telemedicine evolved. So the other challenge is live data acquisition. So after renting the data, we have been improving on the data acquisition on the local laptop. But slowly in the future, we are looking at sending the data to cloud as long as we are meeting cybersecurity guidelines. And the next one is customized solutions for each patient. So after getting all the data, Isoglav has been sold in different countries. We are slowly getting more data, and the machine will be becoming more and more smart or intelligent, so that we can ask the machine to customize solutions for each patient based on the assessment result. But right now we are still doing more manual work based on the patient, because we are still trying to study the patient situation. And also some patients are not so patient. So they got frustrated after using, and they didn't see very fast or very immediate result. So this is very normal, because rehabilitation is really a very long process and very challenging process. So that's why we do a lot of reports and summary of improvement, so that we can really improve, encourage the patients to continue. And the other thing is there's no much control on other therapies that they are doing. So some patients are doing active therapy with very good therapies, and some are not really active in other therapies. So that's why we also have a holistic approach. Every time we visit new patients, we would like to know what exactly they are doing every day, and what are the other therapy sessions that they are doing. Sometimes we also introduce good therapists to patients who are not doing enough therapy, because we realize for hand rehabilitation, if your shoulder and elbow are not properly rehabbed, finger rehabilitation will be basically negatively affected. So that's why we have been encouraging patients to do proper upper limb rehabilitation, not only with Isoglav, but also with other methods or with therapists. Yeah. So this is my sharing today. So if you have any questions, please welcome to ask me. Yeah, thank you.
Thank you. Thank you, Jen, again for the great presentation about Exoglove, and also about all the clinical studies that you guys have done.
Yeah.
And right, so we now open the floor to questions coming from our participants. So we welcome all of you to ask questions. And in fact, we already have several questions already in the Q&A box.
Okay.
So yeah, first is coming from Oscar. So the question is, would Exoglove Myo be available for home use?
Yes, I believe after by end of this year, once we launch the device, once we get CE mark and all the important certifications, we are able to push Exoglove Myo to home as well, so that we can get more data from patients and make sure the machine is more intelligent. Yes.
And I think also wants to know the difference between the Exoglove Myo to the previous models.
Yeah, the main difference is actually the EMD sensor that we integrate together with Exoglove. So we are able to provide active training by detecting patients' muscle signals. So also we are able to track patients' muscle signals and to understand the muscle health, whether it's improving. So once we detect improvement, we might be increasing the intensity of the training or the difficulty of the exercises. So the whole protocol might be changed for the patients. So the whole idea is to create machine learning and artificial intelligence so that the equipment can become more intelligent and more automated for home use.
Right. So how much does the glove assist you in terms of the movement?
Okay.
Yeah.
Where is
So how much
Oscar
does
again?
yeah, exactly.
Okay, so I would say for most of the patients, we are able to, if let's say MS score is around 2, which means the spasticity level is quite serious, we are able to help them to open the hand fully. And we are definitely able to help patients to close their hand almost fully. Depends on how you wear the glove. Of course, you need to wear it properly so that the range of motion is optimized. But again, for patients with MS score more than 2, let's say 3, sometimes we need to do some other stretching first. And once it's softer and we are able to wear the glove, and the glove help you to stretch and to open fully.
I think it's the last question from Oscar. Why is it more useful to move both hands while using the gloves than just using one hand?
Okay, unfortunately, my doctor is not here. The neurologist is not here. He's supposed to, but he's treating patients. So basically, this is according to the clinical trial result. If you move the healthy hand together with the affected hand, the healthy side of the brain is able to help the reconfiguration of the affected hand side of the brain. So that's why actually there are a lot of studies available, like mirror therapy is already kind of proven, to be effective. But based on our study, it's not only mirror therapy, not necessarily to be mirror therapy, but also you just move both hands together to use it together to help your affected side of the brain to reconfigure or build the neural pathway. Yeah. I believe we have doctors here, so later hopefully some doctors can also explain.
No, yeah, I agree as a therapist that it does activate both sides of the motor cortex and the sensory cortex. So that's it's also more functional to use both hands than just the one hand.
Okay,
so
great.
yeah.
Thanks, Sarah.
The following question is, do the patient complain about moisture and a skin issue while wearing the exoglove at home due to the humid weather in Singapore? Thanks,
Okay,
Jen.
interesting. Very good question. Actually, we surprisingly, we don't really have patients complaining that. I think partially because the glove design is open palm design. So that's why actually the surface touch the fabric is not so much. Maybe I can just wear for you first so that you can see. And all the material actually they chose are, biocompatible material and braceable material. So basically when you wear it, it's like this. So that's why it's not really like a full glove, which is too warm. So so far we don't really have complaint of patients using at home. So not everybody is using aircon. When they are doing therapy, we do have patients living in HDB. They just use a fan. We also have patients who use aircon. So it depends. But so far, no complaint about that.
Okay, thank you. And right, the next question will be, who access the patient at home and prescribe the therapy dosage?
Okay, for now, sometimes we go, the company founders go directly to visit patients so that we also try to learn by ourselves. For us, we have enough experience and knowledge on, what is the best protocol by using our own device to treat patients. Sometimes we also invite therapists to join us together, especially after the first visit, we realize, okay, the patient situation is very unique. For example, last week I visited a patient whose situation is very different from most of the patients. Probably the region of the brain damage was very unique. So that's why I came back and have to talk to doctors and therapists to to discuss what is the best protocol for patients. Yeah, but most of the time, our internal team will be going and prescribe the dosage.
So the next question is El Mustafa. He thanked you for your presentation. And what is the advantage of your system compared to Sinfonia Gloria from Italy?
Oh, wow. Okay. Good question. I hope we don't have Gloria friends here. Okay, I think the main difference is the mechanism. For us, we are using a pneumatic design, right? And Gloria is using cable-driven design. So I think quite obvious from the system pictures, you can see Gloriha control unit is quite big. And I think for their device, it's pretty much a B2B focused device. They have big table, they have 2-arm support, they have a TV, computer screen, and they have a huge control box. So it's a high-end B2B device. For us, we try to make it more versatile. So our device, because of the pneumatic control, we can make the control unit very small. So the whole main advantage is really our device is very, very portable, and basically can be used in any environment, and we don't need to occupy a lot of space. And at the same time, compared to cable driven, I think soft robotics mechanism is more compliant in nature, which means we are not pulling the hand in a very harsh way. So if the patient's hands are very, very rigid, we are just trying to comply to the shape. So we are not going to create a lot of potential injury or pain for the patient. I'm not saying Gloriha is creating pain. I'm just saying the two mechanisms are different. So soft robotics are more gentle, but it doesn't mean that the strength is not enough. So based on our observation, so if patient's hand is very rigid, after with soft robotic, we are not pulling them very harsh, but after, let's say, 5 minutes, the hand will be fully opening. So it's a very gentle and soft approach, yet it's effective. Yeah.
Thanks, Jane. So next, I think we have from the UK, Helen Hobbs. Hi, Helen. Thanks for joining us today. Did you use any more sensitive functional outcome measures? I think that's based on the study.
Okay, actually for our new, because this one is more like a home rental study, and so that's why we are not really doing a very professional way of functional outcome measures. But with our new clinical trial with 3 hospitals in Singapore that we're going to start next month, so we are going to have more sensitive functional outcome measurement, and hopefully we can publish the paper by next year. Yeah. Oh, Prof. Singh.
Yeah, Prof. Wee. Hi, Prof. Wee.
Oh, Prof.
So,
yeah, sorry.
Yeah. So the question is, do the therapists assess the patients regularly at home before changing the parameters of the training? And how frequent is the evaluation?
Yeah. For now, because of the limited manpower that we have, we are doing a monthly visit. I think that's so for now it seems quite enough, because rehabilitation is relatively a small process. So that's why we do a monthly visit to conduct evaluation, and also to change to upgrade the protocols. But then again, sometimes patients do send us videos in the middle, so they will arrange video calls with us. So sometimes we also have, virtual kind of conversation or something similar to telemedicine. Yeah. So we also gave, feedbacks and improvement or virtual assessment on them. Yeah, within that month. Yeah.
Thank you.
So our next question is from Yvette. And would the Exoglove Myo be applied to kids? So like stroke patients, CP patients?
Yeah, right. We do have quite a lot of requests from therapists who are treating kids or parents. So right now we are doing some improvement on the Exoglove to make a small size glove for kids. Of course, there are some limitations, because if you make the glove very small, the range of motion might be affected. So right now we are doing some research to solve that issue. So hopefully by end of this year, we are going to have some kids version glove to help patients. So it's not only Exoglove Myo, but also I think the current version, we are going to improve the range of patients that we can treat. Yeah.
I think the next question is coming from Rachana Pandi. Correct me if I'm wrong, if I didn't understand the question very well. Does with every movement the assistant level adapts? So my personal understanding is that does the assistant level adapts to any other movements?
Unfortunately, no. We have to, the therapists or the users have to preset the assistance level. Basically the assistance level for both closing and opening can be adjusted separately. So we have from 5% all the way to 100% assistance level. So basically for most patients, after the assessment, we can already decide what is the best assistance level. for them to use. But in the long run, of course, the goal is to make it more intelligent, and to after assessment with our sensors, we can automatically suggest, okay, this is your suitable assistance level for Exoglove to help you. Yeah, then we can do an automated setting.
Okay. So next question. We have lots of questions for you, Jay. And can we use your device in a collective rehabilitation establishment, or is it exclusively intended for home use?
Oh, okay. Yeah, sorry, I didn't explain clearly. Yes, it's actually initially supposed to be a B2B device. We were mainly, we have international distributors. So in international markets, actually, we were mainly selling to rehab centers and hospitals, nursing homes. But only recently, last year, since Singapore, after COVID, we started in Singapore for home rental first. So it's more like a test bed also to see whether it's feasible. But in the long run, we do hope to also extend our home therapy sessions to other countries if it's feasible. But yes, definitely we do sell our devices to establishment like hospitals and nursing homes and rehab centers. Yeah.
The next question is coming from Shah Rahman. So Shah is from Bangladesh, and the question is, how do you give training for the home patients?
Okay, normally we give training, if you are talking about the how to use the device, right? We give training actually to patients, caregivers, and of course, patients themselves. So for patients, a family member, normally here we do have caregivers like the children, or the wife, or husband, or even mate. So we just give training to them, and we give them instructions. What is the protocol you have to use for this month? So they will follow, because the whole user interface is very easy to learn. So far, we also have very elderly patients, they just do it by themselves without any issue. So the whole idea is when we design the whole device, we are not designing like very complicated hospital-based user interface. We purposely made it very simple to follow the instruction to do the setting. So even people who are not educated, we do have some helpers who didn't really go to higher education, but they can easily use the device as well.
Thank you. So we have another physiotherapist from Hops Rehabilitation in the UK. Do you know how many repetitions the patients complete within a session?
Yeah.
Does the device count the number of patients?
Yes, we do have a database right now in the system to record what exactly the patients have done, the training that they have selected, and how many sessions, the sightings, the assistance level. So all the sightings will be saved in the computer. In the long run, will be more remote, like cloud system that we can access remotely. But right now in Singapore, due to the cybersecurity, there are certain control here. So we are not doing that. We just save everything in the computer.
Great. And there's another question coming from Helen's again. Hi.
Yeah.
So are you considering including some haptics in the future?
Good question. We have been thinking about that, but we have not been thinking to increasing like sensory flexible sensors in the glove yet. For now, we have been thinking to use sensors like lead motion, interior sense, those kind of sensor to conduct assessment and for them to conduct active training. For now, not yet planning to use flexible sensor. But maybe if you have any feedbacks or suggestions, we are more than happy to hear from you.
Right. So thank you everyone for joining us, and thanks Jen again for the wonderful sharing.